Penny. So this is Penny. Penny is approximately 4 or 5 years old, Labrador Retriever. I got her as an adult, and she was housebroken, which was nice to not have to deal with that. I'm just getting samples out of her ears to be able to determine, are we dealing with a bacterial infection or a yeast infection? And what I will do is actually make a microscope slide, look at it under the microscope to be able to determine what we're dealing with. Yeast infections are by far the most common type of ear infection I see in dogs. We only need 3 or 4 drops for a heartworm test. Good dog, Penny. Good dog, Penny. She was up to almost 90 at one time. When I first got her, she had good appetite, and I was, seeing her every day. You don't necessarily realize how much weight they're putting on, and I brought her in and stepped her on the scale. It's like, oh, wow, we put on some weight. So we cut back on her food and easily got her back down to a really good weight. And this is a really great weight for her, what's commonly referred to as a head halter. And for walking unruly dogs, which Penny can be, you have a lot more control over a head halter. One of the more famous ones is something called a gentle leader or a promise halter. A lot of people confuse them for muzzles, but because it's wrapped around her muzzle, but she can still open her mouth. She still potentially could bite somebody even with this on there. But when the dog moves, because the leash is attached to her nose and not to her neck, when she, pulls and it pulls her head to the side, she's generally not going to go in the direction that she's not looking. And for walking her, the difference between using a head halter and just her collar is night and day. It is a pleasure to walk her with a head halter on her, where not so much with just hooking the leash onto her collar.